it is 1 in 3 American adults that have hypertension. Hi you guys, welcome back to my channel. It's Crystal Christine, and today's video is going to be about me doing or explaining to you how I perform a manual blood pressure. So before I get started, I also want to say, when you're doing a blood pressure, you first have to understand what are the normal levels of a blood pressure per resident or per patient, whether it's an infant, a child, or an adult. So you want to make sure you know all your blood pressure ranges. You want to make sure when you do your blood pressure that you know how to perform your blood pressure correctly, so you won't misdiagnose the resident as far as their treatment. Here are the proper equipment that you need in order to perform a manual blood pressure. First, you'll need a stethoscope and your blood pressure cuff. And also, you want to make sure that you're using the right cuff. Now, you can also measure the circumference of the patient or the resident's arm to make sure you have the correct cuff. And it also have the ranges here on the cuff. Now, here where you see the adult size, and then here's the ranges when you get those measurements on the adult. And here you have the measurements. Now, depending on what arm you will use, even if you're doing the right or the left arm, you want to make sure that you put, say for instance that you're using the left arm, you want to make sure you put this part right above, maybe 1 or 2 centimeters above the antecubital area where you found that brachial artery at. So you want to make sure you get all the air out. When you have your stethoscope on, and how you determine the systolic and diastolic, you want to listen for the Korotkov. The first phase is where you hear the Korotkov, which is that whoosh noise. That's the systolic. The last sound you hear would be your diastolic. When you performing a blood pressure, you want to also make sure that the patient isn't stressed, isn't in any pain, doesn't have any IV sites. Make sure the patient doesn't have make sure the patient didn't have a mastectomy. Make sure that the patient doesn't have a fistula. Now, if you have that in any one of those arms, do not use the arm. You see those IV sites, you want to make sure you use the opposite arm. So you want to make sure your patient is resting and for about 5 minutes before you start doing your blood pressure. You want to make sure that when you're doing your blood pressure, make sure the resident is sitting straight up. You want to make sure that their feet is flat on the ground on a flat surface. You want to make sure their arm is at heart level when you're getting their blood pressure. Now, when you're using a blood pressure cuff, if your blood pressure cuff is too large, you will get a low blood pressure, and if it's too small, you will receive a high blood pressure. That's why it's best for you to use the correct blood pressure on the floor. You want to make sure that legs isn't crossed. Their legs can't be crossed, or if you're getting their blood pressure while they're in the bed, just make sure you sit them up and make sure their legs isn't crossed so you can get an accurate blood pressure on the patient / resident. When you putting on the blood pressure cuff, you want to make sure the cuff is either 1 or 2 centimeters above the antecubital area, and then you want to place 2 fingers, because you don't want your blood pressure cuff too tight because it would be uncomfortable for the patient. So make sure you do the 2-finger rule. You take two fingers and then you put it under the cuff so you'll know that the blood pressure cuff isn't tight. Once you have the blood pressure cuff on, you want to take your stethoscope. You want to find the brachial artery. Now, once you found that brachial artery, You want to use 2 fingers. Once you found that brachial artery, make sure you place that stethoscope right on the brachial artery. And you never want to use your thumb when you get in the brachial artery. You can take your fingers and kind of place it around like that, and you want to place it right on the brachial artery. When doing a blood pressure, make sure that your clothes or no type of objects come get between the stethoscope, because you could get a false reading as well. If they got on something thick like this, you would just ask the patient, is it okay for them to remove their arm out of their sleeve, or can they roll it up so you can get an accurate blood pressure? Now, something like this, they will have to take off. So like I said, you place the stethoscope over the brachial artery. Once you auscultate that first sound, which is the carotid cough sound, that's the systolic pressure. And once you hear that last, once you auscultate that last sound, which is the 5th phase, that's your diastolic pressure. Once you hear the pressure decrease, you will hear the carotid cough sound. When you're performing a blood pressure, you want to make sure you have the right cuff. So you can purchase something like this, where you have where it goes step by step in the cuff ranges that you need, and it comes with the stethoscope and the sphygmomanometer right here. This is everything you need depending on what unit or what floor of the hospital or nursing home that you work in. So I kind of want to demonstrate how I do a manual blood pressure on my daughter. So she's 11 years old, so I'm gonna get the child's blood pressure cuff. Since I'll be doing it on my daughter, this is the child size. Okay, here's my daughter China, and I will be performing a manual blood pressure on her. And notice how she's sitting straight up, and she has her feet on the ground with her legs uncrossed. So now I want to start by asking my patient, are you in any pain?
No.
Okay, have you did any exercise or anything?
No.
Okay, so now she's in any pain, she's not in any stress. So the next thing I want to do is take a look at both her arms. I don't see any IV sites. She doesn't have a fistula. She didn't have a stroke, or she didn't have a mastectomy. So I want to go ahead and start by trying to figure out what size cuff to use. So I'm going to be getting the cuff size here. I'm going to be getting a child size cuff. This is the child size cuff, if you can see here, with the ranges here. Now you can also measure the circumference of her arm and look for the measurements if you didn't have a child size cuff, or to use the right cuff. Place her arm on the table so her arm could be at heart level. Go ahead and place your arm here. Yep. Okay. And then I'm going to make sure that there's nothing on her arm. Make sure her clothes is pulled up and her arm is free for me to perform a blood pressure. Now, this is her left arm that I'm using. And here's her antecubital area right here. So I'm going to palpate her. I'm going to palpate her brachial artery. So you want to take 2 fingers and you want to feel for the brachial artery. I feel her brachial artery, so I'm going to move 2 centimeters, 1 to 2 centimeters up, and place the blood pressure cuff in this area. Once I got her blood pressure cuff on, I want to put 2 fingers under the blood pressure cuff so it won't be discomforting for her once I inflate the blood pressure cuff. Then I'll take my stethoscope. Then I'll go ahead and place the diaphragm on the brachial artery. Then I want to also make sure that the needle is on 0 and after you do a blood pressure. And then I'll take my diaphragm, and never use your thumb. You want to use your 2 fingers and place it here. Then I want to go ahead and tighten up, not too tight. And I'm going to inflate to about 1/6. And I got 100/70. If you have to perform a blood pressure multiple times, you don't never want to keep taking it in the same arm. You want to switch to the arm. Or if they have any IV sites in that arm, you want to wait and then come back to this arm. If they have any IV sites or any fistulas or anything going on, you want to make sure that you just come back if you have taken this blood pressure in this arm already and you didn't get your results. Once you're done taking a blood pressure, you want to make sure that you tell your resident or your patient exactly what their blood pressure was, and make sure you thank your resident. China, your blood pressure was 100/70, and thank you for letting me take your blood pressure, and you have a nice day.
You too.
Okay, you guys, I finished doing my blood pressure on my daughter, and hopefully that was helpful for some of you. I thanked her for letting me use her to demonstrate to you all how I do a manual blood pressure. The only way you'll get better at doing a manual blood pressure is practicing, and practicing makes perfect. Please leave me some comments down below if you know some different techniques that I could do. Please list them as well. I'll try to get more, like I said, more videos out there to you all. I love putting these videos out. I love making them. I have a little one. I had to keep stopping, to take care of my baby in order to get this video out here to you guys. Yeah, she wants me. My little 11-month-old wants me to herself. If you like this video, give me a thumbs up, subscribe to my channel. Bye, guys.